the average life expectancy in the United States is 77.28 years old, whereas in Canada, the average life expectancy is 81.75 years old. That's greater than a 4-year difference in Canada, whereas the United States spends a lot more on their healthcare system per person that lives there. Now, this is a statistic that's been used to justify the notion that the Canadian healthcare system is superior to the American healthcare system. But is that actually the case? That's what we're going to be talking about today. How's it going, everyone? Welcome back to the channel. My name is Gianluca, aka Dr. Calcagno. I'm a final year family medicine resident, currently working and studying here in Canada. And this is part 2, so my final part in my little mini-series comparing the Canadian to American healthcare systems. If you missed the first one and you want to learn about where the spending and budget goes for both of these countries and how they compare, I'll link it up here. It's really interesting. I bet it's going to catch some people off guard. In today's video, though, we're going to be looking at everything that's not financially related. If two things were made totally equal and both countries spent the exact same money on their healthcare system, what are the actual outcomes? What's the patient experience like? And that's what I have here. I've pulled up a whole bunch of data comparing everything, looking at primary care and emergency care and specialist referral, average wait times, just some really great information in here. And a lot of the stuff is really difficult to look up. That's one thing that I noticed for myself. The statistics aren't entirely the most accurate in many cases, and what I really tried to do is, in my best way possible, make sure that I'm having some reliable data here. And the numbers are shocking. They really are, to see the differences between the Canadian and American healthcare systems. And it's something that I see firsthand for myself. And I think when I make videos like this, really important to remember, I'm a Canadian doctor that's going to be working for at least the next 5 years here in Ontario. I'll talk about me setting up my practice and things like that in a future video, but I have all the contracts and everything signed. And I'm excited about it, but I think we need to talk about this more because I think that the Canadian healthcare system sometimes gets romanticized when we look at it on the news, and as a result, certain political institutions use it to push agendas. Let's talk about the facts here today and see what the experience is actually like between the two different countries. So first things first, primary care. And this is an area that I could really talk about given my background. But first thing to really piece out here is that in Canada, primary care is predominantly provided by family doctors, pediatricians, nurse practitioners, whereas in the States, internal medicine doctors actually provide a lot of primary care, and that's not really something that's very common here in Ontario anyways. We'll start off with the Canadian stats. According to the most accurate data that I could find, approximately 1 in 5 Canadians do not have access to primary care. This is an additional 2 million people since 2019, and it's expected that by 2025, this number will grow by an additional 2 million people. And because the population of Canada is relatively small compared to the States, every increment of 2 million people represents a significant burden and definitely has many family medicine specialists on high alert about an upcoming crisis. This is one now, it'll get worse. Now, to anyone who doesn't live in Canada, you might be asking, well, what happens if you don't have a family doctor that you're registered with? You have to go to a walk-in clinic for your primary care, or you go to urgent care in the Emerge, and we'll get to that in a second. But the average wait time for a walk-in clinic here in Canada across the different provinces is about 37 minutes. Now, I find that stat to be a little bit unrealistic. I've seen it much longer in some cases, but 37 appears to be our national average. The last thing to know is about wait time to getting to actually see a family doctor once you've been put on a wait list. It varies across the different provinces. There are some reports here in the worst case scenarios of people waiting more than 10 years to have a family doctor sign them on to their practice. In my area, what I'm seeing is it could be 1 to 2 years for the most part. Now we'll contrast to the States, where in the United States, the stat is about 30% of all Americans do not have access to regular primary care. In addition though, when you're looking at walk-in clinic wait times on average in the United States, it's about 18 minutes. A national average that is about half of what it is here in Canada. Okay, next we're gonna move on to emergency healthcare. So emergency medicine, if you are trying to see a doctor in an emergency room setting here in Canada, according to a recent report from CTV News, it's about 2.2 hours for everyone looking to see a doctor in the emergency room on a non-emergent basis. You're not having a heart attack, you didn't get involved into a car crash where you're having internal hemorrhaging or something of that nature. This number varies drastically. This is downtown Toronto in Ontario. If you go to Quebec, they have some of the highest emergency room wait times anywhere in the country. Now, let's say you show up at the emergency department and you are going to be admitted to the hospital. You went in, there's DKA, or there's some issue that needs to be managed in the hospital. On average, from the time that you are seen in the emergency department to when you need to get a bed and actually have a bed in the hospital, the country's average is about 20 hours. And in some cases, it's approximately 40 hours. And the way this works is if you're ever in the emergency department and you hear them call a code gridlock, it means there's no beds in the hospital. And unfortunately, this is something that I've seen happen quite regularly. And if you have any family or friends that work in healthcare here in Canada, you know that code gridlock gets called all the time at the hospitals. Now, that 2.5-hour wait time, it doesn't sit well with me in my area as someone that's worked in the emergency department here. If you go on to where I live right now and where I'm working, and you could Google and see what the average wait times are right now in some of the hospitals around here. About 5 hours is what it is at one of the hospitals. And that comes with a caveat, because 5 hours is actually the highest that it'll go. We don't have additional numbers that'll go above 5 hours on the website. So really, what are we looking at? It's hard to say. This summer when I was working rurally, certainly there were nights where the average wait time was about 7 to 9 hours in some cases. Now, numbers coming out of the States, again, will vary. The same way that I just said that, it varies drastically from the average here, I expect that for sure at some hospitals in the States, I could bet the numbers are a lot higher. But what we're seeing national average, according to the CDC, on the low end of the scale is about 24.1 minutes to see someone in the emergency department if you go non-urgently. And on the high end of the spectrum, 48.7 minutes are numbers according to the CDC to see an emergency physician non-urgently. Now this one absolutely blew my mind. Admission to hospital bed from when you're seen in the emergency department. National average in the United States, according to usnews.com, about 103 minutes. And even on the high end of the spectrum, in some states, about 300 minutes in some cases. Contrast that to between 20 and 40 hours here in Canada. And anecdotally, one final piece that I just want to add in here, I didn't know where else to put it in the video per se, having treated patients in the last little while that lived in the States and were here in Canada on vacation, and have specialists that I had to coordinate with because their specialists are in the States and they gave me certain directions or instructions because they're the ones that's been following them. The amount of imaging that we have access to here in Canada is significantly less. And in many cases, we don't have access to MRI. Many hospitals do have CT in the very least. It might be easier to get access to CT than MRI, but I've had specialists in the States express their frustration to me about not being able to get certain imaging done here in Canada. Now, on that note, specialist referral, Canadian average, 27.4 weeks is the average specialist referral time from when a family doctor sends that specialist referral. If you don't have a family doctor, you could see why there are patient frustrations with not being able to see a specialist, because you can't just go into a specialist office without being referred by a primary care physician. In the States, their average to see a specialist is about 26 days. So again, drastic change in wait time. Little caveat again, this is going to be anecdotal now. I know I talk a lot about the family medicine crisis here in Canada, and that's just because that's my experience. That's what I can talk about from the things that I'm seeing. But I'll definitely shout out the specialists here too. There are multiple specialties that are flat out turning down referrals right now just because they are over capacity. You cannot refer people to neurosurgery for evaluation because they're overbooked. And if you're in an area without neurosurgery and you have to refer someone somewhere else and they can't get there because they don't have a car, for example, what do you do? And that's the situation that we're stuck in right now. Next, we'll move on to elective surgical procedures like knee replacements, for example. Knee replacements, hip replacements, joint replacements in general. This study here defines a successful endpoint as having a joint replacement done in 6 months after your referral. So that's a good job. You were referred, and we'll call that a success that you got a replacement done in 6 months since your referral. Only in about 62% of the time does that happen here in Canada. And finally, the last big category that I want to talk about is access to new medications. Medicine is a science, and primary literature happens and new drugs come on the market, they're tested, they're made available. The CMAJ, which is the Canadian Medical Association Journal, they have a statement about Canadians getting access to new drugs, because certainly among patients and among healthcare providers, there is a thought that, hey, is it actually true that Canadians don't get access to new drugs at the same rate that other countries do? So their statement after their review is that 1/3 of new active substances approved by the United States and Europe between 2016 and 2020 had not been submitted to Health Canada for review. So what does that mean? 33% of all new treatments that were available in Europe and the United States were not even submitted to Health Canada for review. But they expand a little bit more and saying out of that 33%, more than 3/4 of the new active substances not submitted for review would have joined 6 or more similar drugs marketed in the same therapeutic class. So they're trying to say that the majority of these drugs, there was a similar enough counterpart that already existed in Canada. Furthermore, that it is overwhelmingly likely that a lot of these drugs that weren't submitted to us probably wouldn't have shown much therapeutic benefit to patients. New drugs come on the market all the time. They don't always work in patients the same way they do statistically. You could do things like manipulate numbers for statistics to show that they work. Really, how much benefit does it provide the patient? Not much in many of these cases. But what I will say from a practical standpoint is that I have two examples here of medications that have made amazing differences in the way that we manage patient care. For example, propofol. Every emergency room physician uses propofol. It's a drug, uses an anesthetic, and was first released in the United States in 1989, actually a relatively new drug, but wasn't made available in Canada until 4 years later, so 1993. So what I'm trying to say here is that sometimes they do get through where there is a delay in certain medications, okay? Trikafta is another one. This is a medication that is used for people with cystic fibrosis. It's actually a very main part of treatment for cystic fibrosis right now. It was made available in the United States in 2019 and in Canada 2021. So we had to wait about 2 years for that medication to become available here. Really important, I just want everyone to know, I'm not trying to cherry pick data. I'm really trying to give just examples. Now, I'm sure it's not outside of the realm of possibility where there are medicines that came available in Canada first before they were available in the United States, but just sometimes there are examples and disparities between the two countries. And with that, that's all the stats that I have for you today. So let's bring it all together now. Where do we sit at the end of this video? Undeniably, we could say with certainty that the Canadian life expectancy is higher than the United States life expectancy by a pretty decent margin. 4 years on average is pretty large, I would say, anyway. Especially when you consider certain cancer therapies that are thought of as revolutionary breakthrough medications that are only proven to show outcomes of improvement of an additional 6 months of life in some cases from people using it and people not using it. Like 6 months in many cases is how we define significant success. But when you consider things like access to primary care and emergency care and specialist care and elective surgeries and new drug therapies, the picture becomes a lot less clear as to who has the superior healthcare system. I'll leave that for you to decide. I just wanted to present the stats for everyone today. One final piece of information that I want to leave you with before you listen to another politician tell you that the Canadian healthcare system is superior just because we have a higher life expectancy on average. The overall prevalence of obesity in the United States is about 41.9%. And when you contrast that to Canada, the overall prevalence of obesity is about 26.6%. So it's roughly half for the sake of this argument, half. When you look at diabetes, higher in the United States as well. So in the United States, diabetes prevalence is about 11.3% compared to 8.9% here. You see that on average, Americans work more hours than they do here in Canada. And finally, there is more gun violence on average in the United States and Canada. That's not even getting into all of those different statistics, but you see that there's a lot of other stuff that plays into it. And for people that use the healthcare system, you'll see that neither system is perfect. And I don't think that it's fair to romanticize one versus the other. We have two different systems to address our very different populations right now. And I don't think that either of them is doing a perfect job. But all I could do and my colleagues could do is try our best to treat the patients that we can and really give people the best care possible. And that's where we'll leave it. So let me know if you guys learned something in today's video. I'd love to hear you in the comment section below. If you thought I did a good job, let me know. If not, add. And I promise you, I really try my best with this stuff. I love working here. I'm gonna be staying here for the next little while. I'm also doing some training with the United States and doing my USMLE and things like that, but that's just a personal thing that I wanna do. We'll talk more later. See you all in the next one. Everyone take care.